Well, good afternoon, Steve. It's great to have you here.
Good afternoon. Thank you.
So I'd like to introduce Steve Pitman. He's a nurse practitioner in the Hume region. This is part of our Meet the Expert series that we've been doing all year, and we're very excited to have him here. It's great that all these wonderful people are giving us their time. I'm going to start with an acknowledgement of country. So we'd like to acknowledge the traditional owners of country throughout Australia, and we recognise the continuing connection to lands, waters and communities. And we pay our respects to Aboriginal and Torres Strait Islander cultures and to elders past and present. Okay, so here we are. So we've been interviewing a few people around the region about their role and what they do in palliative care, just to give our aged care workforce a bit of an idea of what's out there and what's possible and who's around to support them. So, Steve, if you would mind just starting off and telling us who you are and what you're doing.
Yeah, sure. Firstly, I'm not too sure about the tag expert. I think it's a terminal condition we don't often talk about is expertosis, I think. I'm a very firm believer in everyone brings wisdom to the table, I think, and I think the day that I think I've got a palliative care licked, I think I need to retire.
Yeah, no, I'd agree with that.
So yes, now I work as a nurse practitioner with Yarawonga Health, and it's a new position that was created July last year, very much to support the local community, both in the residential aged care sector, but also in the acute hospital and community. So quite different to anything I've done before. Like I've either, been sort of in dedicated areas, like whether it's be community or in consultation. So just to be across the breadth of residential aged care and acute and community has been really tremendous, actually.
Yeah, that's great. So you're sort of on hand for anybody who puts up their hand and says, please come and help us.
Yeah.
Oh, that's great. So first of all, how did you get to where you are? What piqued your interest in palliative care? Can you give us a little cook's tour of your career to date?
Sure. So I actually, I was in my mid-20s and sort of just working retail and, working sort of seasonal work as well too. And it took me about that long to figure out, I'm in my mid-20s, maybe I need to start thinking about career. So I tried a few different things, and then I actually ended up doing palliative care volunteer training and enjoyed the volunteer experience so much that I thought, maybe this is it. So went into nursing with sort of a palliative care bent right from the start.
Oh, wow, that's fascinating. That's not a path that most people would take.
So yeah, straight after my graduate year, just went working in community palliative care, and then worked in New South Wales as a clinical nurse specialist, then clinical nurse consultant, and then had a bit of a brain snap for 1 year where I thought I might try management. Yes. And realised very quickly that I'm very much a clinical person. So I came back into palliative care as a nurse practitioner candidate with the consult team in the East Hume. So,
and that's based in Albury, isn't it? The East Hume Palliative Care Consultant.
In Wodonga, yeah. And then just came across to Yarawonga last year.
So clearly that what sort of led you into volunteering as a palliative care volunteer to start with?
I think I had a friend who kind of gave me a little bit of a nudge. Right. So he was actually studying nursing, and and he decided to do the volunteer side of things, and it was the impression that he left on me that I think that got me. I was doing all sorts of interesting reading at the time too. Like I was reading a lot of I was reading the Tibetan Book of Living and Dying by Sogyal Rinpoche. Yeah. So that it kind of had a real influence on me at the time too, I think.
Yes. Yeah, I think I was watching the interview that we did last time that we've just released. And it was from Alison Gamble, who's the social worker down at the Lower Hume Palliative Care community team. And she was it's a great video. You should go and see it. But she was talking about the importance of people who are in this work, and that includes all of the aged care workforce, because palliative care is core business in aged care. So we are all involved in palliative care, and just the importance of bringing your whole self, which is, a real sort of, I'm on a crusade to get that message across, but also to be doing the work and grappling with your own mortality, and not seeing it as just something that you come and you're looking after all these poor people who are, appear to be near the end of their lives. It requires us all of these practitioners in this field to be actively engaged in the work as well, and to sort of be almost sort of walking alongside our patients and clients as well.
So beautifully put. I think, you can't do this work without it influencing you, but also, your past experiences influencing your work too, I think. Like, I even look back to years before I came into nursing and palliative care, there's kind of influences and threads that happened back then. I remember I was 13 years old with my sitting at the bedside of my grandmother who had pancreatic cancer.
Yeah.
And it was just her and I alone in the room. And she looked at me and she said, "Oh, Stephen, I think I'm dying." Wow. And my breath was just taken away. Like, I didn't know what to say. And I felt really bad afterwards about, I should have said something, and, I should have done something. And I think I came into palliative care with that question in mind, what is the thing to say and what is the thing to do? It probably took me about 20 years of palliative care to actually learn that I probably did the best thing I probably could have done, which is actually sit in silence and just sit with her suffering,
Wow. That's a story.
So I'd like to be able to, go back to my 13-year-old self and say, well, job well done, but
good.
but there's so much in what you said that resonates with me, that thing of actually sitting with people in their suffering and journeying with them in that suffering, I think is so important.
Yeah, and as I'm doing education particularly with aged care workers who are sort of always concerned, they always bring that question, I don't know what to say, I'm frightened of those big conversations because I don't know what to say. It's sort of like we're so used to fixing things. We're troubleshooters, nurses get in there and do stuff and they fix the problems.
Yeah.
But it's so much more. Most of the time it's just about being there and sitting in silence and just stopping in that moment and being with the person. It's about that shared humanity that's what makes palliative care so great. That's what makes it the only type of nursing that I really want to do, because you do bring your whole self to it, but you get so much more out of it.
I agree. And that definitely that thing of we're trained to fix things and throw medicines at people,
Oh yes.
It takes a real sort of learning to put that aside, and actually, that concept of clinician as medicine, I think, is so important.
Yes. Yeah. And the other thing I'm always trying to do is to sort of show people that they already know so much, and it's just a matter of owning it and sort of saying, oh yeah, I'm actually doing the right thing, or I do know stuff and I can be here for my patients and residents.
I agree. And I think definitely in the context of residential aged care, like don't underestimate the importance of every role and every member of the team. The patient care assistant is quite often the one who's doing the showering and will see the pain and see the breathlessness, and it may be the member of the catering team that sees the swallowing difficulties, and so just the importance of everyone plays a role. And as I said sort of right at the start, everyone brings a wisdom to the table, I think.
Yeah, that's right. It is a team sport. Palliative care is a team sport. That's my little tagline. Yeah, so true. So what is it that you really enjoy now about this nurse practitioner role? Perhaps you could just explain a little bit about what a nurse practitioner does, just for anyone who's not clear.
Sure. So nurse practitioner is somebody who's done some extra training around particularly assessment, diagnostics and pharmacology. So I think it's beyond just being able to write the scripts. I think, you know, it's that thing of in the World Health Organization definition of palliative care, you know, it talks about impeccable assessment.
Yeah.
And so I hope that, you know, the nurse practitioner role brings that next level of assessment and diagnostics and physical assessment and holistic assessment of a patient with a specialist lens. And then, yeah, we've got the opportunity to actually do, you know, some interventions in terms of further testing and writing of scripts and, you know, trialing of medications and everything too. I think it's really important to say that that doesn't replace the medical officer role. Like, I've really enjoyed that space here at Yarawonga in particular. Like, it seems like a real partnership. You know, I'm constantly in contact with the medical officers and vice versa, and we're quite often wrestling with the best management of the patient together. So yeah, but you know, sometimes it can be I'm writing a blood test for a resident, and we know that the GP is coming in the next day to, you know, and then we can review it together and sort of work on that plan of care.
Yeah.
I think one of the disadvantages, I think, for medical officers is, you know, the system's not really well built for, you know, follow-up and, you know, continuum of care and so forth. You know, it's really built, you know, for the one-off.
Yes, that's right. Yeah, it is a time thing. And I think that's where the nurse practitioner role can really, like, I think we need to really sort of be developing it, and the government needs to be putting a lot more emphasis and resources towards developing this nurse practitioner workforce, because I think they've got a real role to play in easing the burden of the just our healthcare, really. You know, that there's so many opportunities for, say, nurse practitioner-led clinics to take the pressure off EDs, you know, and leave the EDs available for the people who, you know, who are really sick, who really need it. But, you know, and across all the specialties, I think there's residential aged care nurse practitioners, and I know we've got a couple of, Wangaratta has an aged care nurse practitioner that does residential inreach, which I think is really fantastic to have. And I worked in Mount Beauty for 25 years and never even knew that role. Well, I don't know how long she was there for, but I didn't know she. You know, it's great to know that there's those supports, and now we've got the Victorian virtual ED, which is a great initiative.
Yeah. There's an emergence of in Sydney, sort of New South Wales in particular too, like palliative care specific nurse practitioners who go into aged care and do what they call sort of palliative care rounding.
Yes.
So actually identifying, you know, specific palliative care needs and so forth. And so when I came into this role in Yarawonga, there was a bit of a question mark as to what the role would be from that aged care perspective. And I think while that hasn't sort of been necessarily named as palliative care rounding, it's kind of taking that flavour. It's really looking at quality of life, and as you said, like, you know, it's core business for aged care. Like, I think 10, 20 years ago, the average length of stay for somebody in residential aged care was, you know, somewhere around 5 years, and it's looking more like 2 years now.
Yes.
So, you know, having that rounding lens where you're actually looking at people's quality of life in the context of life-limiting illness, I think is really useful, I think.
And just support for the staff, and also the things you learn when you're sitting in around meeting. You know,
for sure.
Absorb, you know, it's just that's such a great sharing of wisdom and information, and that collaborative sort of thing. And again, the team sport. You know, you can't do palliative care on your own. It needs, you know, a bunch of heads together, all with a different viewpoint.
Completely agree.
And different sort of expertise. You know, the people who are taking care of the resident, you know, particularly the personal care attendants.
Yes,
they've got expertise about that person that, you know, we could never know. You know,
absolutely
the don't get to see that person in all of their. They don't get those casual conversations as they walk them down the corridor.
Absolutely right.
Sharing them. That's gold. And I think, yeah, we need to make sure that that sector of the workforce understands how important it is. You know, what the information that they're gathering every day is really important to share.
So true.
Mm.
And knowing the person beyond the disease, like, I
Yeah.
think that's where the real strength of the patient care assistants comes in too. They actually know the people very well.
Mm.
And yeah, I think we need that, like, by necessity. I think in palliative care we need to actually treat people rather than diseases, I think.
Yeah. Well, and it's always, what do you want us to do? We're part of your team. What do you need from us? Instead of, oh, you've rated your pain as 9 out of 10 and your nausea as 6 out of 10. So obviously the pain's the worst thing, but we don't know that until we ask.
Yeah, for sure. So from that perspective, I think actually the most useful clinical tool by far for me, I think, is curiosity, just asking the questions.
Yes, that's definitely a good message to get out there. Yeah. So how would you characterize the impact that your role or your job, your career has had on you personally? Would you recommend
Wow.
it to somebody? Yeah. Just a simple question.
Yeah,
in
that's right.
20 words or less. Would you recommend it as a career path?
Absolutely. I think it's probably affected me in so many different ways, I think. Personally, professionally, every part of my life, I think. But I think, as a generalization, I kind of say, like, I always get the question from the family and friends, how can you do this work?
Yeah.
But there's actual great reward and satisfaction from this work. The thing of, if somebody's in pain at the start of the day and they're comfortable by the time you leave, or a family's uncertain about where things are headed, and nobody's actually sat down and taken the time to talk them through, and being able to do that, and you come back the next day and the family are, you can almost see the relief on their faces that somebody's actually talking through that. That's a real gift for me, I think. A real reward and satisfaction you get from the work, I think.
Yes, there's that. Yeah, that real sense of satisfaction is it's massive. And I think well, I know for me, I keep banging on about it because it's sort of just really become apparent this year, or it's become a focus this year. The value of an amazing team, and you would hope that you get good people working in palliative care, and so that means that the team will be good. And I have to say, in Wangaratta, that the community palliative care team is the best team I've ever worked for. And I'd like to encourage people who are watching this to consider what they can do to impact on the culture of their team, because I think if you've got a great team, which means that everybody's supporting each other, and you're all sort of focused on the same goal, and that there's no stupid questions, no one's tearing each other down or sort of judging you for making a mistake. I think if you've got a good team, you can do anything, and you will do it even better. Because I just feel like I'm thriving now because of the team that I'm working with. Yeah,
that definitely resonates with me too. Like, definitely the East Hume Consult team and Wodonga Community Palliative Care were tremendous teams, great teams to work with. A real sense and a culture of building each other up, and bringing the best out in each other, I think, which is really great. And same true here for Yarawonga too. I'm lucky enough to have 2 nurse practitioner candidates who've started working with us too.
Yeah, that's fantastic.
And it's really great people to work with, and again, just trying to bring the best out in each other.
Yeah. So what do you do on a day-to-day basis? How do you? So do the 3 of you, do they work with you every day, or do they work with the consultancy team as well? Or?
No. So they're based in Yarawonga here too. So the candidates are actually doing rounding in different areas. So we've got one candidate who will round in the aged care facilities for 3 months, and then the other candidate round in the community and acute sector for 3 months. And so I'll spend like at least half a day a week walking around with them, and we do joint consultations, and then, you know, sort of team meetings where we debrief on particular patients and residents together and really wrestle with what we're doing. Reflection time during those team meetings. So yeah, so that's been really tremendous too, I think.
Wow.
You know, I think this is true for residential aged care too. Yeah, like I think we don't do it for the money. Like you know, if you were going to do it for the money, like you'd go into merchant banking or something, I think.
Yes.
But I think people sign up for residential aged care and for palliative care for a very good reason, because, you know, they want to be carers and they want to give that, you know, that compassionate care to people. So when I was doing the Pal Care Masters, I did an assignment on stress and burnout for palliative care nurses. And so there was no correlation between the work that we do and stress and burnout. Actually, no, this end of life care work is the thing that gives us meaning and satisfaction. Yeah. So the stuff that actually stressed and burned out palliative care nurses, and I think it would be true to say for residential aged care workers too, it's the structural things that actually stop you from providing that function.
Wow, how interesting.
You know, it's the barriers that actually stop you from providing that compassionate care in a way that is satisfying for you, you know.
Wow, that is so true, isn't it? Because yeah, as I'm educating, you know, it's all very well to say, this is the ideal, this is what you need to do. If someone says something to you, stop everything and sit with them. And I always put that disclaimer, I know that you're all busy, you know, but sometimes this is more important than anything. And yeah, management doesn't see it that way, unfortunately. Yeah, even the latest sort of mandate from the government about how many minutes somebody's entitled to per day. You think, well, who came up with that number,
isn't it? Yeah, that's right.
Like it's. I guess it's good that you're recognizing that maybe it should be higher. But where did you come up with, you know, 200 minutes? You know, is that all that they're entitled to? It seems so.
Yeah, it's an odd concept, isn't it? But
yes.
I think two thoughts there. One is like according to need. So, you know, there might be residents that need that extra time, and you know, it might be at the end of a shift, or, you know, that you actually spend the time actually sitting down and speaking with them. But I think also, like, compassionate care, like, how long does it take?
Yes.
I think it was a really great lesson I learned from Lisa Groot Alberts, who's a loss and grief worker from expert from New Zealand, and she was talking about the tuberculosis wards in the Philippines. There were two 50-bed wards with quite often people top and tailing. She had this extraordinary story of a connection so it was one nurse in each room for the shift, looking after 50 patients. And she had this extraordinary story of the connection that one of the nurses made with this young boy. And she actually had a photo of him, and you could see the smile on his face. And he had these rosary beads hanging around his neck. And this nurse had given him these rosary beads and said, you know, when you're feeling in despair, feel these beads and know that I'm thinking of you. You know, so if a nurse in a 50-bed ward.
Yes, that's right. Exactly. There's always time for compassion.
And it only takes one sentence to say, I hear you're suffering, you know.
Yeah, that's right.
I can see you're in pain, you know. So, so I agree, like that, those sort of time units that we're given is just a ridiculous concept, isn't it? And it should be based on need rather than anything else. Yeah. But yeah, compassionate care also, I would argue, doesn't take very long at all. It can be one sentence.
Yes, it's how what you're bringing, and you, of course, if you're in a supportive environment, you're much more likely to be more giving, I think, because you know you've got the backing of your team. You're much happier at work.
Yes, yeah. You
all carry the burden together.
Yeah, I think that's true too. Yeah.
So in closing, because we're getting close to our half an hour, is there anything, any sort of one big message that you'd like to get across to our aged care staff across the region, or even the ones in Yarawonga? What's your big message?
Well, I think definitely we've talked about that already, like the whole team. Like, don't underestimate the impact of the whole team. I remember going in when I was working consultancy into an aged care facility with another palliative care nurse, actually. We spoke to the manager for about 30 minutes about this particular resident. And then, okay, let's go and see the resident now. And it was like, no, wait, stop. Let's go talk to the patient care assistant first. You know, this is the person who's been doing the hygiene and can tell us so much about the pain that this person's having, you know. So yeah, honoring and paying respect to everyone's role in the aged care team, in providing care, and understanding that they will bring information that will actually equate to changes in the clinical care, you know.
Yeah, and that's definitely, I often describe my role as empowering, like I'm trying to bring empowerment to the aged care nurses. And
love that word.
encourage advocacy, you know.
Yeah.
Don't think that you don't have anything to say, you know. If you're thinking it quietly to yourself, but you've got no, you know, you think you've got no power, jump up and down, because sometimes you are the only person that your resident has said something to.
Yep. And I think that's the second message is, like as you were saying, like palliative care is core business. And even though you might not know that you're doing it, you're probably providing some palliative care, you know. I think anyone in aged care, it may not be named as such, but they're actually palliative care providers.
And it's about quality of life, support and comfort. I love the definition of palliative is, I think it's from the Latin, palliare, is it? Which means to cloak. And I love that idea. Of, you know, like cloak, in one way, it's sort of like, we'll cover up these things. We can't fix them, but we can put this nice layer of. But I like the idea of a cloak sort of holding you.
It's got that nurturing concept, hasn't it?
Yeah. All right. Well, Steve, it's been lovely speaking to you. Thank you so much.
Pleasure. Thanks for the opportunity.
Yeah, I love these conversations. It's really great. And if anybody wants to contact Steve, just look him up in Yarawonga Health. I'm sure you'll track him down. If you've got any questions, send them to me or to Sam, or just get in touch. And thanks again, Steve.
No worries. Thank you, everyone.
Thanks. Bye.